Now to the story of a Maryland mother always on the go, running marathons, even participating in Ironman competitions until a medical crisis stopped her in her tracks. Our Doreen Gensler joins us now from the newsroom with details on her remarkable road to recovery. Hi, Doreen.
Hi there, Jim. J.D. Kelly is an athlete, but just 4 years ago, everything changed for her. She had heart failure and she needed a heart transplant. Her recovery was tough, but she was determined to compete again, and along the way developed an unbreakable bond with her surgeon, a bond that ended up saving both of their lives.
I've been a runner since as far as I can remember. My mom used to tell me that she used to catch me by grabbing my pigtails. It's my happy place.
J.D. Kelly was born to run, competing in marathons and Ironman competitions. But then one day it all came to a sudden stop.
My heart was like beating kind of funny, so I just thought it was the caffeine. And I told my friend, who we do this race every year, I'm like, I need to lay off the coffee.
Turns out she had giant cell myocarditis, a rare and life-threatening heart condition. Doctors told her she would need a heart transplant.
Because she was so sick, she received a machine, a device, a pump that was used as a temporary strategy until she could receive a heart transplant.
Dr. Ezekiel Molina was her surgeon at MedStar Washington Hospital Center in D.C.
Throughout my career, I have transplanted approximately 120 to 130 transplants. She's only the second one that I have transplanted that had biventricular devices or ventricular assist device on both sides of the heart.
That was rare. Even more unusual was the type of heart donor she would need. It took several years of waiting, but the Mount Airy mother finally got the phone call she was waiting for, a perfect match with her surgery set for the start of 2020. The operation was long and challenging, and so was her road to recovery.
She spent several months in the hospital after the transplant. She pretty much had to relearn to walk again. That's how bad it was for her.
I got extremely weak, and I lost a lot of muscle mass and a lot of body weight.
J.D. developed pneumonia, kidney failure, and spent 5 months in the hospital during the earliest days of the pandemic. Doctors say her recovery is nothing short of remarkable. And once she got home, she was determined to compete again, this time asking her surgeon to join her. They spent months training and this past November finished their first half marathon together, crossing the finish line hand in hand.
That race is probably the best race in my whole life.
And Dr. Molina says it's J.D. who actually saved him.
I have to say that she saved my life as well, because this came to my life at a time where I wasn't very active, in the middle of the COVID pandemic, very stressed out about working long hours, dealing with very sick patients, stressful operations. And I have to say, I wasn't really taking care of myself. Finishing the race was very emotional, was one of the best days of my life.
Celebrating the gift of life and learning a valuable lesson along the way.
I was beating myself up physically and mentally because I was trying to compare myself to who I was prior to my transplant. I've learned to not be so hard on myself. That was my lesson of the whole journey.
J.D. says she isn't done yet. She has more races planned. Her ultimate goal is to be the first woman with a heart transplant to ever compete in the Ironman. Dr. Molina has kept running, too, and recently did a marathon with his wife. J.D. is alive today thanks to an organ donor, and she hopes that her story will inspire others to give back, whether it's donating blood or becoming an organ donor themselves. Sean, a really wonderful story to come out of this pandemic.
Organ donation is amazing, and yes, a beautiful story. Doreen, thank you.